Hi, everyone. I want to thank you and the American Acupuncture Council for hosting me. Thank you for coming today. And if we can go to the first slide, I'm going to go ahead and hop right in. So today's presentation is an overview of a multifaceted approach to treating neuromuscular facial conditions. My name is Michelle Gellis, and I teach facial and cosmetic acupuncture classes internationally. And one of the things that I do, in addition to just the cosmetic, is I treat individuals that have various neuromuscular facial conditions that are affecting them in some way. So what exactly is a neuromuscular facial condition? Essentially, a neuromuscular facial condition is any condition that affects the face, either the facial movements or any sort of sensory issues, such as if someone has neuropathy or pain. And some examples of neuromuscular facial conditions, and certainly some of these are not they don't just affect the face, but for many of these conditions, the most noticeable or troublesome part of the condition can be the part that affects the face. So Bell's palsy, Ramsay-Hunt syndrome, synkinesis, stroke, TMJ, trigeminal neuralgia, myasthenia gravis, ptosis, MS, shingles, and hemifacial spasm. When I approach treating any of these conditions, the part that affects the face, what I have learned over the years in practice is that using a multifaceted approach, which I will describe, is the best way to really take care of the issues, and especially issues that have been around for a long time, and to make your treatment long lasting. So these conditions, such as Bell's palsy and TMJ, can have a major impact on the face. And so there are, again, conditions that have to do with more muscular movement. And then there are ones like trigeminal neuralgia, which have pain. So the modalities that I use in order to treat, when I say a multifaceted approach, I will use scalp acupuncture, facial motor points, submuscular and intramuscular needling, facial cupping, and derma rolling. And some of these modalities can be used in conjunction, and some are better for certain conditions, and some are better for other conditions. Scalp acupuncture is a fairly new series of techniques that we use in our practice. It's only been around since the 1950s, and it became popular in the 1970s. And essentially, you're stimulating areas of the brain that correspond to different functions, whether they're sensory functions or motor functions. And it's not based on acupuncture points, it's based on neuroanatomy. And it is really fabulous for treating any sort of neuromuscular condition, but specifically for neuromuscular facial conditions. And if you look at the homunculus, right, if this is a cross-section of the brain and you look at the homunculus, you can see the area for the face takes up the bottom 2/5. If you were to break it up into 2/5, 2/5, and 1/5, the face takes up a huge area of the brain. And the way scalp acupuncture works is you take a needle and you insert it into the loose connective tissue, and you thread it into the loose connective tissue corresponding to the area of the scalp that you would be working on. So here is a map of a couple of the different areas. So we have the motor and sensory area of the scalp on one side of the head. And then this bottom 2/5 here is where you would be needling in order to affect the face. And I'm just going to talk through this video. Let me get it going. So this is me demonstrating how to put the needle into the scalp. First, you have to measure the scalp, and the bottom 2/5 is what you're going to be needling into. And so so the motor area is in front, the sensory area is behind it. And this part of the scalp can be sensitive, so you have to be careful when you're needling. And it's helpful if your patient is sitting up, and then you want to work very quickly. You don't want to be too tentative when you're going in. And you can either use a one-handed method or a two-handed method. I use a one hand for the insertion in the beginning, and then sometimes I'll use two hands to push it down. And then once the needle's in, you're going to stimulate it. And there are a lot of contraindications and precautions, and scalp acupuncture is a very wide field. It requires specialized training, but especially when combined with some of these other modalities, can really affect a tremendous change for some of these neuromuscular facial conditions. So the next is our facial motor points. So motor points are something that have been used. Actually, I found some information back in the late 1800s in a medical book. A medical doctor had mapped out some of the motor points. But most recently, people like Matt Callison and other researchers have really built on this foundation and have used motor points on the body, especially to restore muscle function. So what exactly is a motor point? A motor point is essentially, in a nutshell, the most electrically excitable part of the muscle where the motor nerve bundle is attached. But it's not a trigger point. Trigger points are something different, but it's a place, and frequently many of the motor points that we use on the face are also acupuncture points, so it makes it easy for us to find. And if a facial muscle is in spasm, if it isn't moving properly, if it's overly tense or overly relaxed, then by needling the motor point, it will cause it's like a reset switch, and it will cause it to get back into its normal functioning. As I mentioned, motor points are not trigger points. Trigger points are typically areas along the muscle that can be sensitive when you push on them, but motor points are something entirely different. And as I said, many motor points are also acupuncture points, which is great for us. So here's an example of a motor point. And this is the motor point for the frontalis muscle. And coincidentally, it is also gallbladder 14. And by putting a needle into gallbladder 14 and stimulating it, It can help if someone has ptosis, if they can't raise their eyebrows. It can also help if they're having some eyelid drooping. And another motor point, this is a quick video of a motor point for the mentalis. And this was, I'm going to play it and talk at the same time. So this was a student of mine in class I was teaching. She had Bell's palsy many years ago, and she still was missing some muscle movement in her chin. So I went ahead and I needled the motor point for the mentalis muscle, and try it one more time. You can see the needle, when I stimulated it, her chin started to move and twitch. And I have a lot of these videos. You can see it moving right there. I have a lot of these videos on my Facebook group. It's called Facial Acupuncture, and on my Instagram page. I do a facial acupuncture tip of the week, and some of them are cosmetic and some of them are neuro. So that's a good place if you want to see a bunch more of this stuff. So some examples of motor points. For example, if a person cannot smile, there are 4 main muscles that are affected. The zygomaticus major, which draws the angle of the mouth upward and outward. The zygomaticus minor, which elevates the upper lip. The levator, labii superioris, which elevates the upper corner of the mouth, and the risorus, which retracts the angle of the mouth laterally. So by knowing which motor points to use, you can help someone who has lost their ability to smile. The next thing is submuscular needling. And this is something that is uniquely suited to help with a lot of different disharmonies of facial and neck muscles. And essentially, if a muscle, much like motor points, if a muscle is not functioning properly, then you can needle either underneath the muscle or through the muscle, and it will help to bring blood and chi back to the muscle. And it's great for people who have had long-term paralysis. And when I teach my class, I go through all the different facial muscles, but the big few are the corrugators, the frontalis, the temporalis, and the masseter. And you would needle from the origin to the insertion. So for example, this is the frontalis muscle. You would thread needles on either side, just like this, underneath the edges of the frontalis muscle, and you just put them in. You can stimulate them a little if you want, but you want to try to get underneath the muscle. It is a lot less painful if you do. If you're working with a bigger muscle like the masseter, you might not be able to get underneath it, so you would be needling through it. But this is kind of how you would needle. So underneath the muscle on either side. And this is what this would look like. And again, I'm going to talk through this. So the first thing you have to do is measure the muscle, and the best way to do that is ask your patient to raise their eyebrows, because the muscle is on either side of the eyebrow, and when they raise their eyebrows, you can see the skin right over the muscle will wrinkle. And then you are just going to needle right underneath the edge of the muscle. I usually use tubes, and that helps get my angle of insertion correct. And then I will press down on the skin to get it way underneath the muscle. Again, I'm not treating wrinkles. This is not cosmetic. This is a way of bringing muscle function back into the muscle. And then I'm going to, once I've done one side, so here I'm showing if you angle too deep, you're not going to be able to get underneath the muscle. If you go too superficially, you won't be able, you'll just be hitting the skin. So once you've done the lateral side, then you're going to come in and you would do the medial side. And I'll do, depending on their forehead, I'll either do 2 or 3 on each side. So this is just for one eyebrow or one side of the frontalis. If you were treating Bell's palsy, then you would just treat the affected side. And if you were needling the temporalis, this is what that would look like. The next thing is facial cupping and gua sha. And facial cupping and gua sha is designed to bring blood and qi circulation to the skin and the muscles. It helps to relax tight facial muscles and facial tissue. It can move out stagnant lymph and toxins. It helps the lymphatic system to function better. And if the lymphatic system is functioning better, then the whole face will function better. It helps with inflammation, and it will help to strengthen the vascular integrity of the face. And it can help with any sort of nerve entrapment, especially if the facial fascia has trapped some facial nerves. So here's a cross section of the face, and the face is the only part of our body where our skin is attached to muscle. And so the functioning of the muscles and the nerves that make the muscles work is very important, because if the muscle's not functioning properly because the nerve is entrapped, then the skin is not going to move and you won't be able to fully smile. So here's a picture of that, bone, muscle, skin on the face. And this is a picture of fascial adhesions. So the fascia is this stuff. It's like when you have chicken, if you pull the skin off, that stuff that looks like spider webs. So it really helps to release a lot of that in the face. And facial cupping is not like cupping on the body. You don't leave the cups. You stimulate different acupuncture points on the face, and the cups are meant to move. And this is just a slide from one of my classes where I'm showing gliding and then suction and releasing down the neck into the lymphatic drainage area. And also, derma rolling is something that can help to stimulate the channels, kind of like our channel rollers that we might use on the body. Well, derma rollers have these tiny little needles on them, and you can stimulate the channels on the face, stimulate the qi, and your patients can buy a derma roller from you, and you can teach them how to use it. And then it will stimulate, they can do this at home in between treatments. So what are some of the neuromuscular facial conditions that we can work with, that I've worked with? I mentioned in the beginning, Bell's palsy, stroke, TMJ, trigeminal neuralgia, MS, ptosis, hemifacial spasm. And I have enough time to just talk about one, and I'm just going to talk about Bell's palsy, which is the most common form of facial paralysis. And typically it just affects one side of the face. Usually it's temporary, but the people that come to see me have had Bell's palsy frequently. It's been years. They still don't have complete movement of their face. They've tried everything, and then they come for acupuncture. It can affect blinking, opening and closing the eyes, facial expressions, hearing, taste, the salivary glands, and did I say hearing? It can affect their hearing. So I use a multifaceted approach. I'm going to do my body points. I'm going to do face points. And depending on their underlying conditions, what's going on with them, of course, I'll treat them constitutionally. And then bringing the multifaceted approach in, I'm going to do motor points on the scalp. So the lower 2/5 on the opposite side. I might use ear shen men and face points just to like calm the patient, treat their face, and then have them do some exercises. Look at their face, have them try to move different parts of their face, figure out where the paralysis is, and then do facial motor points and possibly some submuscular needling to get these parts of the face moving. Cupping and gua sha is great. Derma rolling is great. And you're going to want to see the person 2 to 3 times a week until they get the movement back in their face. So I teach cosmetic and neuromuscular acupuncture, facial acupuncture classes. My website is facialacupunctureclasses.com. And some of the products that I was showing, the cups, the gua sha tools, the derma rollers, microneedling devices, are at aculifskincare.com. And these are my social media links. I do have a bunch of live classes coming up, and all of my classes are also recorded. So that is the end of my slides. And again, I want to thank the American Acupuncture Council for giving me this opportunity. Next time is Sam Collins, and I believe he's next Wednesday. I can't see that right there, but it is next week. So you want to check in with that. He'll be streaming live. And do we have time for Q&A? Are there people on that we can open it up to? Are there any questions? Crickets. Okay. Well, I'm not seeing any questions in that chat box. So I am not now. I guess there's no questions now. Okay. Well, thanks again to the American Acupuncture Council. And if you need to reach me, you can just drop me a line at facialacupunctureclasses.com.